right, guys, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and I'm always enthusiastic about the episodes, otherwise we wouldn't do them. But I'm extra enthusiastic about this episode because today's subject matter is one that requires a tremendous amount of courage for a patient to come talk about. Now, I can talk about any subject matter without a patient, right? We can talk about whatever, labioplasties, and I can talk about it. But I find that the episodes are so much more effective and patients seem to connect with the episodes much more when there's someone who's going to talk about their journey, because their journey is going to be so often similar or synonymous to their own journey. So to get someone to come on the show required for them to be willing to talk about whatever surgery they had. So today's subject matter and today's topic is about inverted nipples. Now, for some people are like, oh, what's that? For the people who know what I'm talking about, this is like, oh my God, I can't believe someone's finally talking about this. So we are indebted to the patients, but I'm extra grateful to my patient, beautiful patient, Samara, who was, honestly, I say courageous because nobody ever wants to talk about shit. They're just like, I did it. It's my, anonymity. It's private. I don't want to talk about it. And that's understandable. But then no one learns shit from anyone, right? At the end of the day, you go online, you're like, God, I'm thinking of getting a nose job. Here's all these people's photos. Here's all these people's testimonials. Here's all these videos. So then you feel comfortable. But when you go to inverted nipple world, it's like crickets. It's crickets. There's very little information. Usually it's just doctors talking about the procedure. So today we're going to talk about inverted nipples, the journey, and mostly from the patient perspective, what it's like, why, how, who, all those things. So welcome to the show.
Thank you.
So we were talking about it earlier. I want you to describe, if you don't mind, sort of when you started to notice that you had inverted nipples, what was it like when you're like, oh, okay. And when was your first understanding that, oh, this isn't like everybody else?
I think I must have been about 8.
8, okay.
I was changing with my girlfriends and I noticed that there was something almost different about myself.
Right.
So I think that's when it first occurred to me, and then since that point, it almost got a little worse.
It got worse as you became more aware. Now, did you notice it because you just noticed, you're like, wait, I don't look like them? Or did someone bring it to your attention? Did anyone make fun of you about it?
No, it's interesting. Thinking back, I don't think anybody brought it to my attention so much as just how I thought about myself. It's just how I would look at my friends, and I didn't notice that they had the same, that they looked the same as me.
So because your anatomy was different,
yeah,
you were like, wait, they don't look like me. So no, thank God you didn't get bullied about it, because a lot of these kinds of things, or often when kids start to notice, or young adults, like ears, they get bullied, which makes the circumstances 1,000 times worse. So here you are chugging along. At what point did you bring it to the attention of an adult, like your mom or your dad or your grandma? Did you tell anyone?
So I didn't tell anyone, and I remember going for my checkups when I was younger, and nothing was brought to my attention. So I didn't think anything was wrong, but I knew something was wrong.
Right.
So I think it was just when I was comparing myself to my friends my age, and I just, it didn't feel,
obvious. So you never went to your mom and said, hey mom, my friends look this way or whatever. So you kept it to yourself the whole time.
Yes, and also the way I grew up, this is probably a little irrelevant, but I grew up in a very cult-like atmosphere where anything was shameful to talk about. Mm-hmm. So I feel like for me, I just didn't even bring it up because I thought, there is no point. I should just
this is what it is. Do you have siblings?
Yes. Brother and sister.
And your sister does not have inverted nipples?
No. Mm-mm.
How old is she?
She's 8 years younger.
So she was kind of irrelevant because you were 8 and she was whatever.
Yeah.
So then your mom, you've seen her naked, obviously changing.
They were,
normal.
Very prominent.
Right, okay. Yeah. So here you are, the two closest, well, your younger sister maybe not so much, but your mom and your aunt or whoever it was. So you were telling me, which is interesting because I'd actually never heard this part before. Mm-hmm. Once you noticed, you were like 8, you're like, wow, this doesn't look right. And then as you started to get older, you became 13, then 16, then 19. Throughout that time, you went through different things to try to manage this circumstance. Clearly at 16, you're not like, I'm gonna go get inverted nipple surgery, right? You're just like, wow, okay, how do I deal with this? So why don't you tell me some of the things and some of the places in which this became a real self-conscious issue and what you did to get around it?
Well, I remember the first time I ever had those thoughts was when I was going into middle school, and I asked my mom if she could homeschool me. I never told her the real reason, but the reason I told her was for religious reasons and that I would do whatever made her happy. But for me, I was extremely insecure about having to shower with other girls because that's what I had heard.
Right. You'd heard that when you go to middle school, maybe there's like a shower and whatever, you're like, oh, hell no.
Yeah, so I wasn't into that at all. So I asked her to homeschool me, and she did. And I was extremely relieved that I didn't have to be naked in front, even girls.
Right, of course.
Yeah, even like my peers who probably at that age just don't care, or at any age, but for me it was such an insecurity.
That's so fascinating, and it's interesting that, again, you just kept it to yourself.
Yeah.
And you're like, because, you know, it is interesting that for a lot of people, their issues or things that make them self-conscious, it's actually interesting that they feel ashamed of it, even though it's like, I was just born this way.
Yeah.
Right?
Yeah.
Okay, so then that was a first phase. And then as you got into like sort of a young adult female, you know, you're out, you're with girlfriends, there's intimacy starting. How did that all come together?
Yeah, so I would say maybe in between like that age to being a young adult, before I get into the intimacy, I do want to talk about being at the beach or at the pool with my girlfriends. And I would just be in a bikini, and I would always have to make sure that it was lined, that there was padding in it. But I would sometimes, if it was not open, I would take some scissors and open it and make sure to add more padding inside, because you could see the like little crater form.
The contour of the the inversion you could see through. Right?
Yes, like a little donut crater, however you want to say it. So I think that was more like my teenage years, then I kind of dealt with it that way. But as I got older, it was more about how I connect with somebody intimately. I have to be confident as a person. And I wasn't. And so I would try all these suction cups, and I would bring all these devices with me. And not a lot of people are educated on inverted nipples. I remember a couple times in an intimate situation, I had guys that would tell me, they would think I wasn't
aroused, stimulated.
Yes.
Right.
Yeah.
That's so interesting. I didn't think about that.
So I would have to explain to them, no, I am, but this is my anatomy. This is how I was made. And they would tell me, oh, this is weird. I've never heard about this before. So then I'd have to explain it.
Right, which is very awkward.
Yes,
right, because I'm assuming this happens while you're not, it's happening while you're intimate, as opposed to you're not like, hey, we're about to get intimate. Let me explain to you what's about to happen.
So because of that, I started giving a disclosure. Before I was ever in an environment like that, I would always have to kind of talk about it beforehand. And I would have my hair covering my breasts, and just so that way I wouldn't have to talk about it. But then sometimes it made sense to talk about it. So then I would kind of give a disclosure. This is how I'm made. This is what it is. And it almost made things worse. Right,
because it's
because it was such an inner process.
And it's also such an, you have to present the conversation before it's appropriate. Right? You're not even intimate. Like, why are you telling me this? And you're like, because when we get intimate, this is going to be super awkward for me.
Yes.
So I have to tell you this because I don't know if we'll get there.
Yes.
And what a burden.
Yes.
As it is when we're getting to know people, you know, it's already, there's so many thoughts going on. But this idea that you got to carry this huge suitcase around with you of concepts, what a burden it is to be able to be free to get to know someone, because I've had patients, and I've obviously had the honor of taking care of so many people, that whatever condition they were dealing with, whatever physicality they were dealing with, was so much of our physicality presents during intimacy, right?
Yes.
My saddlebags, my labias, my breasts, there's a lot of that connectivity, and so many of them, it would inhibit them from being intimate because in a weird way, they didn't ever want to get intimate because they didn't want to have to get into a situation where that thing that really makes them self-conscious would present itself. So they were in this self-sabotaging round.
Yes.
And they would almost
sense.
not put themselves in situations where they would meet someone who they would really grow to like, that they would get intimate with. You had mentioned something about a prosthetic, which again, I didn't know about, which is fascinating to know, which makes sense because this is sort of something that is missing, and so you can add to it. So tell me what that was like, and what was that?
So I decided to go online and I ordered these prosthetic innies that nipples that are for people with inverted nipples,
right? So
specifically, or that don't have
or don't have prominent nipples.
Yes,
right.
Exactly. So I ordered them, and they're kind of just like pasties that you put on, but they have a nipple, a prominent nipple. So I ordered them specifically for the reason because just to feel more feminine and under clothes. Sometimes it's nice to show that,
right?
I guess.
And that eliminated that part at least, where you would have to you'd have to put more padding, right? So at least now I had something present.
So it was either or for me, because if I was just myself, just as I am, that there was always something. So either padding or the prosthetic. So the times that I would use it, I remember one time specifically, so I had both. I had to use this super glue.
Right.
And so I pasted it to my skin. It looked great. I was really confident. I was really happy. I wore my bikini top. I was at a day club and I thought, okay, this looks great. But I didn't notice that one had slipped down to my torso with my sweat because it was hot out and I'm dancing. And so one had slipped down, and that was extremely embarrassing. Thankfully, one of my friends had seen it, so she told me about it. But that made me stop using it. And from that point, I'm like, I have to do something about this. It's affecting my life.
Well, right. And it's funny. It's not funny, but it's so fascinating that one would think if someone were listening, they're like, I don't even understand. What's the big deal?
Right.
And it is a huge deal. And anyone who has this condition, 100% of them will say, I know exactly what you're talking about. And it's so fascinating that something so small has such a massive impact in the totality of an individual's life.
Right.
It isn't a mole, right? It's something that a nipple is reflective of so much, right? It's femininity, it's sexuality, it's nursing, it's so many elements, and it's like this tiny little thing has massive impact. So now tell me, at what point did you realize, wait, there's a surgery for this? When did that kick into existence?
Yeah, I've known about it for a while. I did my research years ago when I was in my 20s, and I think at that age, what my friends had to say really impacted me. And so I talked to a few of my close friends, and they would say, oh, you don't need to do that. Like, going back to what we were saying earlier, I'm perfect. Like, I should just love my body as it is. So I dealt with it in those ways that we were talking about. But then I think being a little older, and now I'm 34, and I thought, this is really starting to affect. I waited long enough that I thought maybe I could just get away with it.
You know, it would be something that affected you when you were immature.
Yeah, that's a good point.
And now that you're a mature young adult, mature young woman, like this, God, that was
I thought that would pass.
I can't believe I was so worried about this thing, right?
Yeah.
But
no,
didn't.
Still at 34, it's been such a big thing for me. So then I started doing research, but in my research, everything was about how, if I want to fix my inverted nipples, I should get them pierced, or I should use suction cups, or there didn't seem to be enough information on the actual surgery.
Right.
So then I started just making time for that. But where I heard about you was from this one podcaster that I listened to, Sophia with an F.
Sure.
I had already researched you. She kind of just made it more certain.
Right.
And I was like, okay, I just need to do it. This is it.
And something you had
right.
And something you had mentioned to me, which I think is really, really important for people to hear and understand, is this idea of being gaslit.
Oh, yes.
Right? So whatever your issue is, inverted nipple, small-breasted, large nose. And mind you, I use the word issue meaning it's an issue to you. It's your journey and it's your own mental process.
Yeah.
And it is very normal that when you reach out to people you love, your family or your friends, they're going to tell you, oh, come on, your nose is fine, your breasts are fine. And then they level it another level higher, saying, you should love yourself, which immediately is insulting.
Yeah.
It would suggest that if I don't like my big nose, I don't love myself.
Yes.
And then they take it another level higher, which is whoever you will be with should love you the way you are. And then what that suggests, and it's very insulting yet again, is that I'm worried that someone won't love, I don't love myself, and I'm worried someone won't love me, when none of that is true. And the reality is that this makes me unhappy, and I'm the one that doesn't like it. And that when I'm intimate, it's not that my partner is going to be like, what is that? It's more like, I don't feel my normal self. And for me to be fully present, I need this fixed.
Yeah, I did it for me, definitely. And a lot of people don't realize that.
So that's not unique to you. That's unique to almost all of my patients who get a lot of heat or backlash by people who love them, who judge them, who then oddly, by trying to support them, make them feel shitty. Which I just want everybody to hear that part, because it's not specific to inverted nipples. It's specific to everything else. If the person is totally well-adjusted and normal and mature, as you are, and says, listen, I hate my nose, and you're looking at yourself, I don't even understand what they don't like it. And them fixing it will then liberate them from whatever it is that they're dealing with. It isn't because they're so insecure that nobody would like them or whatnot. So I wanted to really underscore that before we move on to the next phase, because I think it's really important that so many loved ones want to help their people that they come to them, and they think by saying the other things it's actually the right answer, and it's not. So you decided, okay, I'm going to go. Was that the only consult that you did?
No,
okay.
I did too.
So you decided, you know what, I'm going to fix this inverted nipple thing. I'm going to go check out and do a consult. And so here are the things that are important with inverted nipples for people to understand. What I ask patients are the following questions. Number one, are your inverted nipples all the time or sometimes? And why does that matter? It means that on some occasions, when I'm cold, when I'm stimulated, when I'm this, that, the other, some patients' nipples are intermittently inverted. They come out, they go back in. That's a different patient than a patient who's like, mine are inverted 24 hours a day, 7 days a week, doesn't matter what time, I can be stimulated and whatever, and they're in. What type were yours?
So yes, I think, what is it, the third?
Right.
I forget the name of it, but that's going back to when I was talking about swimsuits, that would make me think of why I would wear extra padding with swimsuits, because most people, when they're cold or stimulated, their nipples protrude out, but mine would even concave more inwards. Right. So I think that's the third level.
Well, they have categories online, which is like grade 1, grade 2, grade 3. What I was referring to was whether or not your nipples were always in, or they were in, and sometimes, depending on whatever, they would come all the way out.
One. Only one would, my left one.
Right.
Yes.
But your right one was always inverted.
Right one was always inverted. Left one would come out maybe if I use a suction or if I use
let's say you're
whatever.
not doing anything.
Okay.
You're just living your. Okay, so
both.
you are in that category, which is my inverted nipples or inverted all the time. Why that distinction is important is because the correction of inverted nipples, and I'm going to explain you why, the anatomy of it in a second, leads to certain losses of function that the patient needs to take into consideration for the exchange. Okay. So let's back up here and talk about inverted nipples. What happens with an inverted nipple is, a nipple is an anatomical feature, like a nostril or an earlobe, and it's this portion of your breast from which milk ducts come out, arteries go to, and sensation goes to. So you have milk ducts, AKA I get pregnant, I decide to breastfeed, not breastfeed. I have sensation, which is more than your normal sensation, right? The sensation on your arm is nowhere near, for most women, the same as on their nipple. So it's a unique kind of stimulatory sensation. And then there's an artery in there. And what happens with inverted nipples is, in addition to those things coming out, so imagine a cylinder, and in the core of that cylinder are these cables. There are these remnant scar bands that tether and basically, like a parachute, pull the nipple in. And they're holding the nipple down with these sort of ligaments, if you will. And so they don't allow the nipple, in the instance like yours, to ever relax and ever come back out, okay? And in some people, those tethered ligaments are not as fierce. And when they're warm or whatever, the powers that stimulate a nipple, that make it erectile, outwin those ligaments, and so they have some prominence.
Okay.
So the reason why that's important is because the treatment of it is to release and cut those ligaments, release those cords, so the nipple can come out. The problem is that when you do that, often, and I would say almost always, the other structures in there, because they're in one big bundle, get released as well. So what we tell patients, and what I told you, was that in exchange for a potentially neutral or projected nipple, you may lose complete sensation, and you are likely not to be able to breastfeed. The reason why I ask you if it comes in and out is because if it comes out once in a while, you may opt to wait till you've had children, so that there might be a chance you could breastfeed. If you're in the category in which they're always inverted, you have no sensation anyways, because it's not part of my orgasm. I'm not using my nipple as part of stimulation, and you're not going to be able to breastfeed anyways. So you're not losing anything, and you're only gaining. When it comes in and out, you have to ask yourself, well, it only comes in and out once every Haley's come. Well, then you're like, well, shit, I'd rather fix it. But if it comes out every day, you might opt to wait. Now, the surgery is to think how much this nipple has tortured you since your young adulthood, since you were 8 years old. The surgery is a relatively easy, straightforward surgery that I do under local in the office. Your surgery was done in the operating room because we did other things, but I could do it in the office. We just numb up the nipple, and then I release those cords, and then I put a few sutures where those cords used to be so that they can't fall back in, and then I elevate your nipple. And to think, oh my God, that whole torture is gone in 30 minutes, 45 minutes. It's remarkable. And I think that on the right patient, it's to say life altering is an understatement. So you did the surgery 6 months ago, right? And so how did it go?
It went great, better than expected. I didn't even care about the risks and complications. I trusted you. I thought, okay, I don't want kids anyways. I don't care about breastfeeding, whatever. Since then, every morning, it's still like my ritual. I will wake up and go straight to the mirror to make sure that they're both, because I know that was one complication where maybe one could re-invert or there could be something. They're both perfect, they're even. Yeah. It's and you go check. You're like, I go check. That's the best feeling.
It is, and it's such a simple. It's such a simple, normal part of one's anatomy that people take for granted. Yes. Right. You're like, what nipple? Yes. And then you're like, well, wait, what would happen if I had an invert? So that's fantastic. I'm assuming the recovery was like.
Yeah, it was easy breezy, but I got other things done, so that's what made it maybe take a little bit longer. That's why I had to go under anesthesia. If I could have just done it in office, like you had said, under local anesthesia. But it was easy. That part, regardless what other things I had done, the recovery, the process, everything was fine.
So let me just give everybody the skinny so you understand. So here's the things you need to know about inverted nipples. So this procedure, the way I do it, and maybe there are other ways, is imagine the nipple as a little cylinder. I make a 5 millimeter incision at the base of that nipple, and then I release all of the tethering cords, and then I'll put a suture to keep everything up. And then we ask you not to wear anything compressive, right, on that nipple for about 6 weeks so you don't crush it, obviously. The pain is 0. The returning back to your normal life is more or less immediate. And the only thing we ask you not to do is to wear anything very tight so that you don't crush the nipples. The surgery we mentioned takes about 30 to 45 minutes, can be done under general anesthesia with other things or local. And here are the risks that are associated with it. Number 1, you can lose complete sensation of the nipple. How's your sensation?
It's exactly as it was.
So
it's heightened.
It's heightened.
It's better.
And that's sometimes the case. You get hypersensitivity because the nerve has to sort of...
But in a good way.
Right, the nerve has to grow back. And so, but the bottom line is loss of sensation, check. Loss of the ability to breastfeed, which you will or won't ever know. If you decide to you never know, your life might change, you decide to have kids, you'll find out. But by the way, women with normal nipples, a high percentage of them are unable to breastfeed anyways. You can get necrosis, this is important, because we're releasing everything and the nipple itself doesn't get enough blood supply for a period of time. So that can happen, it's very rare. And then you can get recurrence, aka asymmetry, which is if someone doesn't, they don't do it correct and they don't release everything, you can get it to go from, to be prominent to go back into retethering, and or it goes back but one does and the other doesn't, or they do a little bit or whatever. So what I tell patients is what we strive for is for them to be projecting. But if we get them to be neutral, which is the invagination is gone, we'll take it. Because there are millions of women with regular nipples who have no projection, but they don't have the invagination, that dark kind of crevasse that you had. And in your instance, it was like a home run, right? Because not only are they the same, but you actually got projection out of them, right?
Yeah, and the projection also helped with hygiene, which I don't think is talked about enough, because for me, having them go in where it's also meant not being able to have proper hygiene.
It's exactly like a belly button.
Yes,
right?
Exactly.
So that's a very good point. Like people were like, hygiene, I didn't even think about that. Yes. I mean, it's an area in your body that has bacteria, has an area that has milk, and everyone's breast leaks out fluids and things like that. And so I 100% agree with you on that. So, I mean, I'm imagining now, given your story and how long it started, and where you are now as a beautiful 34-year-old and having total normal anatomy now, that it has changed the way you approach. Are you dating anybody?
In the dating scene.
Got it. Yes. So then I'm sure that it changed the way you go about your dating.
Oh, completely. But it's also this inner confidence. Even my girlfriends that I've told, I didn't tell them when I was doing the surgery because I didn't want their opinions.
Right.
After I've told them, and they've realized that I have this inner confidence. I just exude completely something that they're not used to. So I think that's really affected me in a good way.
Yes.
Yeah.
Well, I think that number one, I'm so happy for you because at the end of the day, we do these surgeries in hopes that as a result of the surgery, someone's quality of life is improved. I'm not interested in who's judging what or whatever. I don't give a shit about anybody. I and my patients have a very intimate relationship where I'm doing X to you, and as a result of what I did, I'm hoping you have that increased quality of life, which is 99% connected to inner confidence. And then secondly, I'm so grateful that you came, you sat down, you have this super intimate and private conversation with us, so that now a whole generation of young girls who are 8 years old, and now everyone's on YouTube and social media and all that stuff, can, if it comes across, they don't have to feel ashamed. They don't have to feel helpless, and they may not have to wait as long, perhaps, as you did to fix something that potentially has a relatively straightforward and easy correction, but has such a powerful impact, right?
Yes.
We're not talking again about a mole, we're talking about something that's so big in one's life. So kudos to you. We're so grateful. Anything, any parting, anything that you would say? So let's say there's a young girl. She's, I don't know, 14, 15, 12, 18. Any parting messages about that?
Unfortunately, there's not too much information online. Doing my homework, I came across you and your photos, and I think it comes down to doing your homework and really taking the time to see why you're doing it. For me, I did it for myself, and because of that, it made sense I tried all the things before that, the suction cups, all that, the prosthetics. But for me, it made sense to go forward with surgery. So to just kind of pay attention to why you want to do that and to go to you.
Oh, yeah, that was a plug. I have nothing to do with that.
To go to you because
come to me.
You're the best.
I appreciate that. It's very sweet. And I do think that's a very good point, which is just make sure the source of why you do things is coming from within, as opposed to maybe external and things like that. I'm actually very happy that you didn't have a traumatic youth in terms of a tremendous amount of bullying, because that would take this whole conversation we had and it would just make it 1,000 times worse, because people are very, very
It helped that I was sheltered, probably.
Yeah. Well, you were smart.
So...
You made the right call in regards to that. Well, I hope you guys enjoyed that. You better have enjoyed it. And as always, we are grateful to our guests, and that wraps up another episode of Plastic Surgery Uncensored. So we exit, as always, with the following things. If you like our show, you enjoy it, you find it educational, pass this on, share it with someone. You have no idea who has an inverted nipple. You have no idea who is dealing with something, and without sending this stuff forward, you won't know to help them. The second is, if you like our show, go write something nice. Go write a review. Say, hey, you know what? We appreciate this information, because we have to come together with guests and a whole production crew, and it makes everybody feel like their time here spent is worth it. So until next week, I'm your host, Dr. Rady Rahban, signing off on Plastic Surgery Uncensored.